Good morning, all of you. I'm here today to give a brief presentation about obesity review in GCC and the new evaluation strategy. I will start with the agenda of the presentation, which is introduction, purpose, approaches, followed by methodology, most obese country by percentage, literature finding, action taken toward obesity, conclusion, and recommendation. As introduction, as we know today, no country it is out of obesity or far away. According to the World Health Organization, in 2016, 39% of adults aged 18 and above are overweight, which is 39% of men and 40% of women overweight. At overall, it's 13% of the world adults population are obese. It is a 12% men and 15% women. If we take the highest regions for obesity, Oceania Island, it is the highest rate of obesity, and at the same time, it is the least population. Then it's followed by Middle East, which is the second highest region in the obesity, and about 75% of its population are obese. And finally, South America, it is the third highest rate obese countries in the world. According to the World Health Organization that mentioned, there are additional 124 million of children and adults worldwide. It's increased since 1975. My purpose on this stage of my thesis is to review the literature review, to get an idea of the obesity risk factors and the new strategy solution. I go through many articles to get the idea of the issue and what is the causes, solutions, and I make a comparison between the worldwide and GCC. As approaches, I'm focusing on articles that related to obesity factors such as behavioral, cultural, and effect on behavior outcome. Then identify the main trend in the literature of obesity, focusing on environmental factors, people eating habits, their attitude toward Western food, governance policy, socioeconomics, and sociocultural causes. At the end, develop a new framework that include the common reason factors for the phenomena and the action taken toward this problem with consideration to the barrier that cause obesity to be continuous, not to stop or reduce, and especially in GCC. As a methodology, I use the key search like obesity, overweight, obesity factor and causes, obesity solution, and that is. Then I use a tools of that called CASP, Critical Appraisal Skill Program, to choose the right article or the best article in the quality. There's several questions. If the paper it's answer these questions, that means is a good quality. Then I'm keep saying, especially in GCC, for this reason, you see that most of the GCC country are of the most obese country: Qatar, Kuwait, United Arab Emirates, and Bahrain, Saudi. Let's take as an example Kuwait. If we compare the percentage or the rate of the obesity, it's about 39.7%. If we compare it to the number of population of Kuwait, it is a very big percentage. Then, in the literature review finding, I do a comparison between worldwide versus GCC. If we take the first point as recognition of the problem, in the worldwide, there is a medical profession describes obesity as important despite of new evidence. And according to the World Health Organization data set out, the problem of overweight than underweight in many developing countries. Where in GCC, they have that, they motivate for to be physical active, but the absence of supportive environment, their knowledge might not be translated into action. And the lifestyle as a second point, in the worldwide, in the high-income countries, about 26 of men and 35 of women were insufficient physical active as compared to the low-income country. In GCC, we can say that walking and cycling is out of people's life, and automobile now dominates their life. Third point, it's the media awareness. In the worldwide, a lot of restriction on the Western food advertisement in the national TV. For example, it's not allowed to display the fast food and these things of advertisement during the period of children TV show, where in GCC it is popular, the social media, it's very popular, and it's affected their decision. TV advertisements everywhere, in the newspaper, in the first page, and as I said, social media, Instagram, Snapchat, everywhere. The follow point, it's the income. In the worldwide, the highest income worldwide earned by Monaco and USA, it comes in the 8th level, where GCC, it's among the wealthiest country in the world. As followed the point, the obesity, according also to the World Health Organization in 2016, as I said before, that over 650 adults were obese, 39 of adults age 18 years and above, over 39% of men and 14% of women are overweight. In GCC, obesity is a growing concern in many nations in the Middle East. It's about 75% are obese. Then regarding the fast food, the fast food industry or market, it is increasing by the years in both countries, and especially in GCC, you see that in Saudi Arabia, it's lead the region with about 8.9 billion in 2014, followed by United Arab Emirates, Kuwait with 1.9 billion, Qatar followed by 1.3, Oman, and Bahrain, the latest one. Then, the other comparison is in the action taken toward obesity. First point is the public health initiative. And the worldwide health message related to diet, physical activity, and weight control can be used everywhere. In GCC, there is a plan for prevention and control the problem and the consequence of the disease that happened after the obesity or as a result of the obesity, associated with a reduction of obesity about 25% in the year of 2025. And as the second point of natural and lifestyle program, in the worldwide there is a lot of work they did it. They work with agriculture sector and food industry to replace unhealthy food with healthy food. They promote the healthy food and they set a standard. They also try to refine the starch and saturated and trans fat to children on television and elsewhere. Where in GCC, there is an implemented national nutrition survival plan to collect data about the indicator of nutrition. There is an action from national community have developed an introduction of healthy nutrition for children and also engage them in the different physical activity. Last thing is the obesity surgery. It is in both of them are increasing by the year, but in the Arabian Gulf countries is the highest percentage of bariatric surgery. After going through the literature review, I come up with a framework for the obesity factors and action. It is contained of 3 parts. First part is the factors. As you see, that genetic, behavioral, environmental, emotional, medical, social, ethnicity, childhood weight, and hormones. These are common factors all over the world and in GCC also. We come to the second part, which is the problem, obesity phenomena, and what's the consequence of the obesity phenomena. It is the disease, as you see down, that's heart disease and the stroke, high blood pressure, diabetes, some cancer, and so on. The last and the third part, it is the solution, which is public initiative, diet program, and the surgery, where the solution and the consequence disease, all of them, they cost the government and the countries high expense as healthcare medication for the disease and for a solution to solve the main problem. But also I find in the articles that related to the GCC, they are focusing on 3 factors that is not mentioned in the global, which is the economic boom and lifestyle and the cultural with perception and belief. These 3 factors, it is affect the problem in the GCC, which is start after the exploring of oil, because our lifestyle is changed according to that. So people and citizens in that area, in the GCC region, they start to be inactive. Automobile dominate all our life, and also the availability of everything make these people are not active. Plus, as a solution, regulation, we find it's inactive and it's applied in other world. But in GCC, there is a regulation, but it's inactive. So my aim of this framework, if they are focusing to the whole common factors, plus the missing 3 factors, which economics, boom and lifestyle, and the cultural perception and belief, and to activate the regulation in the region.
3 minutes.
So if we add this part to the framework, could help to solve the problem. Then the conclusion, the critical review of literature has demonstrated on the behavioral and physiological issue, impose a significant impact on the development of obesity and overweight and their consequence. Also, over last 2 decades, more emphasis is placed on consideration of the different aspects related to the treatment of obese people to decrease the chance for people to get overweight and obese. Recommendation, it's focusing on raise the awareness in the new generation toward the health life from childhood, which will affect the future of the countries. Put in consideration the missing factors that I mentioned before, the 3 factors and the regulation that contribute to continue the obesity problem. Finally, reduce the healthcare cost spent on solution after it's happened, and find other solution to avoid the problem before it starts. Thank you.